Hello and welcome to Wetin Naw, a podcast that focuses on amplifying the voices of young people in Sierra Leone. I am your presenter, Adama Morgan. Don't forget to like, share, subscribe, and pass the word around. Wetin Naw. This is an engaged salon podcast for and about young people. In our last episode, we put a spotlight on mental health and the stigmas attached to seeking help in Sierra Leone. I'm in Bo Kakua for this episode of the podcast. We'll continue to probe into young people's battles with substance abuse. I'll be having discussions with young individuals who have been battling with substance abuse. We're going to be listening to their personal stories and experiences on substance abuse. I'll also be having a conversation with a public health activist named Aissata B. Kalon, who has been fighting tirelessly to end substance abuse and provides care for victims of substance abuse in the country, most especially in Bo District. Stay connected as we delve into the world of substance abuse and recovery. Substance abuse, also known as drug abuse, is the use of a drug in amounts or by methods that are harmful to the individual or others. Drug addiction is one of the major problems in Sierra Leone. According to the Ministry of Youth Affairs, over 15% of young people in Sierra Leone abuse drug and other substances. Marijuana is the drug that is misused the most in Sierra Leone, followed by kush, cocaine, alcohol, and brown. I'm in Bo District, also known as Bo Kakua. I'm currently at the famous Total Junction. I'm going to meet with a public health activist who provides care for victims of substance abuse, and I'll be having a discussion with the patients that she provides care for. Young people's mental health has been greatly affected by stimulants like tramadol, cocaine, and kush. I am at the Bo District Pioneer Initiative for the Rehabilitation of Substance Abuse Dynamics, normally called PURSUED, to meet with the patients that are undergoing rehabilitation.
Alright, so I guess somebody else now. This woman I graduate from Jala University.
Oh no, they do. Everybody do.
Yeah, then again she's a journalist.
I'm so happy for meet all of Una. Una all they look fine.
I tell you, oh, look at this team boys.
Una all they look very well. And I'm glad for meeting Una all.
Glad day when I was born again, it was a glad day. When I was born again, it was a glad day. When we are born again, it was a glad day. When we are born again, the Siri used to steal, we still there no more. All the places we used to go, we go there no more. All the kush we used to smoke, we smoke there no more. It was a glad day when we are born again.
Ah, the music keep fighting. The music keep fighting. I now have the privilege of speaking with one of the patients here. Hello dear, how are you doing?
Thank God, man.
Welcome to Wetin Naw. What was going on in your life before you started taking drugs?
Well, so many good things were happening in my life. Like, first of all, I was a student. I started to my work and entered a paramedical university. So my life was very good. I was living happily with my family. But because of this drugging, my life got miserable. I left the university. By right, I was supposed to graduate this year. But because of the drugging, I left the university and my entire families and friends abandoned me because of the drugging. Because I started doing things that makes me act like I'm abnormal, like stealing, sleeping on the street, market, sweeping for people. Kush is something very dangerous in our life. So we are really appealing to government. Let government focus on kush and other substances that are coming in our country, because we the youths, we are suffering. Most of them are on the streets without no care, without no home for them to live, without no food for them to eat. So please let government concentrate on this drug, please.
Okay, thank you very much for that. So how long have you been on drugs?
Well, I started this drug, I was in class 6. I was 14 years old when I started smoking. That is marijuana. I smoke marijuana till when I come to JSS 3. I started taking kush. So the kush have been addicted in me now. It made me feel like someone that is mad, that they are a madman walking on the streets.
That's pitiful. So when you take these drugs, how do they affect your mental health?
Like when we take, more especially the kush, when we take the kush stop us not to eat enough food. It will make us even for us to wash, we can't. Even for us to wear something decent, we can't. It makes us to act like someone that is mad, that is on the streets without no family, passing around picking papers on the streets.
Like you're in another world.
Yeah, another world. Which, when someone sees you, even people to allow you enter their compound, they will not. As soon as you pass, they will say, oh, look at this kush boy passing.
Throwing shades at you.
Yeah.
So have you ever stopped or limit your intake?
No, ma. I've never. Every day, the thing got addicted in me. Every day, it got addicted in me. It's only God and Pursuit that have made this kush to leave me. Because we have something in kush we call Jonesy. When that Jonesy comes in you, if you don't have money, you can do anything. You can kill, you can steal.
Wow.
Just for you to have this kush to smoke. But Pursuit have helped us to cut off the Jonesy. Because if you don't have the urge, that the Jonesy in English we call it urge. If you don't have that urge, you will not have the time to go and smoke kush or neither take another substance. So we really want to appreciate Pursuit because it has stopped the urge in us for us not to take that substance anymore.
So since you came to Pursuit, what kind of coping strategies have you been using to stop your addiction to e-gas?
Well. My medication have been coming every day. We have one in the morning and one at night. And this medication help us for us to urinate. And when we take that medication, help us to eat, rest, sleep a lot. I can do everything.
So what advice would you give to young individuals with addiction, but they are refusing to seek help?
The advice I have for them is for them to come for rehabilitation. Many of them want to stop this kush, but they don't have the opportunity. So governments have to intervene in their situation. For those that have the opportunity, let them come for rehabilitation because there is a life after kush. Kush is very dangerous. Kush is the substance that comes for us, the youths, for destruction. So let's be wise and focused. Let's stop this kush and come for rehabilitation.
Thank you very much for that. So you are the one that sang that song against kush.
Yes,
Can you give us a short a cappella?
Yeah.
Okay.
Yeah. Plenty man they talk about this life every day. This life, easy. For put on your mind, stay cool. This one bone not easy. We don't live a sote all sign at the streets. We don't live by season. No rush your life, take a cool and steady. This one not to dream, say this kush game, not to walk. Paddy man a month, not see, not to talk. We don't do an sote, we don't take with a modern union at street. We feel say na luck, say then go put on the arts, bluff, say this na lifestyle. Paddy man trust me, this one a freestyle. Addiction or sickness, me brother and sister. You for no say there is life after kush, oh yeah.
Exactly.
Say not take and put on your mind, there is life after kush, oh yeah. Boss you say let you come for rehab.
That is so wonderful. You can become a very great rapper.
Yeah.
I pray you become that rapper. So stop the kush like you are doing now, okay?
Yes, ma'am.
Good day, sir. How are you doing?
No problem.
So I noticed that you're one of the parents of the patients here. So I want to ask you a few questions. Kush really don't affect you and your family.
So much.
You get two pikin and I see and I one and a black one.
Afraid.
Okay, so when you carried to this rehabilitation center?
The 5th of last month.
5th of last month. So from then to now, how you see say then don't they improve?
Well, thank God. I don't care 3 times. This don't make me 3 times. Thank God. I don't see them body. Then even the health. While I don't can't see them making 3 days. Thank God.
So waiting are your advice to parents then with them picking and they on drug abuse and then they neglect them and I know they carry them for help?
Well, I will give my voice out. Me na Joseph Tamba, na me born in 2 man there. I dey tell any parents they read this me talk when they interview me so for me then able console them picking them. If they get way, if they don't get money, if they able sell them for party for cow them picking them. Make them take medicine for me they left this drug because the way I be see me picking them to today, I praise God because the condition we don't go out of hand. But I thank God today I don't can see them by in person.
Thank you very much, Mr. Joseph. One of our guests today is a person who loves modeling and is passionate about football. He's a very bright young man who has requirements for the university, but is a victim of substance abuse. Hello and welcome to Wetin Naw.
Just because I'm taking the drug, so that's why I'm not continuing my education. Just I have my requirements, so I started taking the drug 2021.
So can you share with us some of your personal experience dealing with addiction?
When I have taken this drug, when morning reach, I am not having the drug, water running my eyes, I feel headache, my body is warm. But when I have taken the drug, my system is normal.
Okay.
Yeah.
So when did you decide to stop taking drugs?
And I decide June 6, I decided to stop taking the drug. Till up till now, I'm not taking it.
So what kind of coping strategies are you currently using to cope with your addiction to e-gas?
I'm taking the medication in rehab center, so that gives me the hope so I will not have the urge to take in the drug.
So what advice can you give to young people that are still battling with addiction?
So I'm talking to my friends and fans to stop taking the drug and come to the rehab center.
Thank you very much, guys, for sharing such heartfelt stories with us. Your stories are a testament that individuals can recoil from addiction and overcome the challenges that are faced with recovery, which eventually will enable them to become better versions of themselves. Hi, Madam Kalon. It's so wonderful to meet you. We're honored to have you on Wetin Naw.
Pleasure too.
Madam Kalon, you've been providing therapy, education, and recreation to ensure that victims of drug abuse are able to achieve meaningful lives back again in their communities. How long have you been working as an activist on drug abuse?
Well, I've been in it since 2015. I was one of the focal person. We made a draft for the Sierra Leone alcohol policy, wherein very recently, 2022, the health minister, Osti Dembi, signed the draft and we've launched it. And it happens to be ECOWAS selected me again to be one of the addiction professionals. I've been trained and we got some certification from the ECOWAS Commission. So I got to become addiction professional, and besides, again, I studied, my discipline is public health, so I thought it fit that public health covers every healthy life of a human being. So for me to be a public health addiction professional, I feel proud of doing my work.
Madam Kalon, what is the prevalence of drug abuse in Bo District?
Well, the prevalence of drug abuse in Bo District is in the increase, because for so long we've been battling with those young boys, girls, they are on the street. The drugs craving is really disturbing them. But for us as addiction professional, we came in for us to detox them, because that's the only way we can do for them to go away from the harmful drugs they are taking.
So what are some of the consequences of substance abuse?
Well, substance abuse is not good for human beings, because some are illicit, some are legal. Like for the alcohol, it's legal because government is taking tax from producers, while the other harmful drugs like the kush, tramadol, the cocaine, heroines, government is not taking any tax. So, and it's very deadly and harmful to human beings. So we want to really encourage government to enforce the law that illicit drugs should be banned in our country, Sierra Leone, a small country, and even the youth population degrade, because the number of people we want to see them produce in good productivity, they are not in. Even plenty of them are in work, but because they are in addiction, they are not doing well. Some are even having sickness, because as you do know, addiction is a disease because it has signs and symptoms.
What mechanisms do you have in place to mitigate the use of substance abuse by the patients you care for?
Okay, then we do first education, because we want them to get awareness on the drug they are taking, which is very bad. It's harmful to their health, even to their brains, for them to focus on anything they can't be able to do. And as well, we do psychoeducation, because for the victims that do come to our center, we educate them to know about the dangers of drugs, the degree of which drug you can take that can lead you to psychosis. Drugs can induce crime, drugs can induce diseases, drugs can also lead you to sexual penetration or rape cases. We are having some of them at the correctional centers who are victims of drug, and they take the drug and they commit the crime. So we also go down to the correctional prisons, the juvenile centers, to correct their mistakes that they did before going to the crime. So when you come out, you'll be able to adapt your system to the outside world. So these are the things we talk to them about. Then we also tell them for them to know that drugs should only be prescribed by doctors or health practitioners. You should not just take drug by your own, because you have to be mindful of the degree of the milligram you are using. Drugs are in measurements. So if you don't mindful of the measurements you do take for the day, You know, even your social life cannot be complete. Your healthy life cannot be complete because you get malnourished. Some are not eating, you know, because they are always on the drug. They don't have time for food. They don't have time to drink water, and they are having a lot of health complications.
Okay, ma. Do you receive any form of support from the government or non-governmental organizations?
Well, from the beginning, we registered our rehab center since 2022, and officially we got some support from the Life Relief Development. They gave us food to supply in schools for school children, and that food was sufficient. We gave some school students, and again we took some of this food to correctional centers because we thought it fit that those guys there, they need the food. And we also got support from the PIH, Partners in Health, backing up with the psychiatric hospital. We are in partnership with them since I got the training from the psychiatric hospital, the teaching hospital, you know, so we are in that kind of close collaboration. The psychiatric doctors do come and clerk our patients, you know, they see and they diagnose for them and they give them the treatment they want to give. And Partners in Health is helping to give us the medication. So, and for the government, they've started because we got 25 kilo bags of rice from them and an amount of 2,000. We appreciate the government also. And now officially the government has opened the response for the Kush victims. So we are part of the district task force. I'm one of the pillar lead. So we are about to strategize how they can come in to assist us because we need more for them to make our facility to be adequate. We are contributing to government for the reduction of the drug.
So, Madam Colon, what would be your advice for young people that are struggling with addiction but are resenting rehabilitation?
Well, the first thing first is the deniers. We are having some clients, they deny because the drug they are taking, they want to deny. Say, I'm not taking drug. So we want to create awareness for them to go away from denial because it can kill them. Then again, we want to tell the other ones that are in victims for them to come for rehabilitation. Because you can't go away from drug without having detox. We are trying to encourage for them to see their future, for you not to trade your future for drug, you know, because you have to take care of your own home, your families, you have to go to work, you know, you have to be an employer or an employee. So if you are on drugs, you can't perform very well.
They talk about this life every day. This life is not easy. Not easy. Body for take a cool. Put on your mind. This one bone a reason. We don't live as we take outside. Now they treat. We don't live by season. Now rush your life take a cool and season. This one not to reason. Say this push came not to walk. Body man a much. Not see not to talk. We don't want something. We don't take. We from good and you then that's it. We feel say not love. Wait, then go put on their hearts blow. See this na lifestyle. Body man's goes with this one a freestyle. Addiction or sickness, me brother and sister. You want to say life after push. Yeah. About take and put on your mind. There is life after push. Yeah. No left it on them tell you there is life after push. Yeah. Boss you want to tell you say there is life after push. Yeah. Once you say then you can't for the camp that is life and push game, make you not put on a face. It doesn't waste you time and make you delay. And sickness don't cancel we they take that as play. And that make pussy self don't cancel we hate. When you not smoke kush party, you not get for die. Now only one pack kush to make you feel high. When you see the kush joy, you begin to think out for buy. Then we think for left this kush and live a happy life. Then we think very fast before time will be late. And that make pussy self don't cancel we hate. We community say, that's how we go there. But we prove the wrong and tell us say, there is life after kush, oh yeah. Now for take and put on your mind, there is life after kush, oh yeah. No left seat on they tell you there is life after kush, oh yeah. Boss you want for tell you say there is life after kush, oh yeah. Boss you say that you come for rehab. I want to say big thanks to mommy Isa. You don't make right now we be a proud.
So we then self where they don't they add the exercise, other things they talk to them, they decide for play a friendly match with the one way they did at juvenile center because they're confident na their side of it. We push make the end up there. We can enter and praising them all. We picking the impasse to show their love. And if the things that every way them do way bad, show love with somebody where they in recovery. That they help her for their come out. you not go to harass him, you not go to beat him, or you tie him, or you drag him, you go in the streets, you go take more of the drugs where you know they expect. So now the best way this follow we treat them, we they see with problems. Some man they I guess similar problems, some man they are on a different drug they take. But we pay ourselves, and also we talk to ourselves for avoid the game. Yeah, because then they don't know say drugs bad. Not so. When I know say drugs are harmful, It make you continue schooling. Not so. It pull you out from cause, It make people talk about you very foolish. Not so. Then small picking they don't begin to get respect past woman now. Not so. Because small picking get my points by you say, look that kush boy under. Not so. And I stain, I stigma. Some of una get picking them, una get for show love to the families. The mommy themselves, they need una life them. The parents then they don't suffer with we. Say who's una don't reach, they not go and see una life miserable. Some man don't get penda, some man they die, some man they not got herself. If they perish, family not even go take them. Because that condition we did now, nobody no wants them. Yeah. So una not going to one ever. Some of them they will get for graduates for let them they back in the community. And even when they go to the community now, we write for the look after on our back. Let all continue for the talk. Who say the struggle, we make like no. Not go relapse. You were there for go school, pay attention to the school, focus to your own goal. Your own future plans. Because not so your mama, papa will ever live na your life forever. Not so. You self get your own life for make. You get for make your own family. You get for make you get for make your own picking them. Then say go ask you una picking them. So now all are the admonition. The treatment when they take, when pay attention to them. Yeah? The education they will give now is very, very much important. Where they out in community, behave well. Nobody know what to call you that kind of way because you don't get the kind face here, you know they behave that kind of behavior. When I go home, then if the man they be there, we avoid them. So we'll all be of best practice. Now this time your admonishment to now this morning, yeah?
Thank you very much, Madam Kalon, for your care and dedication to ensure that the eradication of drug and the rehabilitation of victims of drug abuse is met in Sierra Leone, especially in Bo District. Our next episode promises to be just as engaging. We'll continue to probe issues that affect the lives of young people. Stay tuned for more informative stories and discussions. Remember, it's all about asking, Wetin Naw? What's happening in the lives of young people? Until next time, keep amplifying those voices and driving positive change. This is an Engaged Salon podcast funded by the Fund for Global Human Rights. Don't forget to follow us, like, and share the podcast. We rely on you to pass the word out there. I am Adama Morgan.